Is it?
Yeah. So we're going to be talking about congenital heart defect. We'll talk about first the circulatory changes from gestation to birth. The fetal heartbeat typically starts around 5 to 6 weeks of gestation. That's when the cardiac tissue begins to pulse and can be detected by the ultrasound. The heart rate at 6 weeks of gestation is approximately 110 beats per minute, and the heart is fully developed by the 10th week of gestation. Congenital heart defect usually can be developed during the early stages of embryonic development between the 3rd and 8th week of pregnancy. So on the 3rd to 4th week, you have the formation of the heart tube and the major blood vessels. The 4th to 6th week, you have the development of the 4 chambers of the heart and the valves. And the 6th to 8th week, the completion of the heart structure and functions. So it's important as nurses to tell women of childbearing age to make sure they don't that they have their immunizations so they don't get different types of problems that they would have with vaccines to keep their baby's heart to develop normally. Also, you tell them to not, drink alcohol or smoke or all those things play a factor in their baby's heart development. So the next thing we'll talk about is the fetal circulation. During pregnancy, the mother does all the work to provide oxygen for the fetus via the placenta. The lungs of the fetus are bypassed by 2 connections, which are the foramen ovale and the ductus arteriosus. And these 2 connections usually close after the baby is born and it begins to breathe. The foramen ovale allows oxygenated blood directly from the placenta, from the right atria to the left atria to the baby's body. The ductus arteriosus is a temporary blood vessel that connects the aorta, which is the main artery of the body, to the pulmonary artery, the artery that carries blood to the lungs in the fetus. There are several causes of congenital heart defect. There's genetic factors such as mutations in the genes involved in the heart development, and if the family has a history of congenital heart defects, they can also develop in the baby. Environmental factors such as maternal infection during pregnancy, maternal diabetes, maternal smoking or alcohol use during pregnancy, certain medications taken during pregnancy. Other factors include premature birth, low birth weight, and certain birth defects, such as DiGeorge syndrome, which is a small part of chromosome 22 is missing, and that's the same problem that they have when they develop cleft palate. That would be hard. Please get back. Oh, right. So there are acyanotic heart defects, which are the atrial septal defect, ventricular septal defect, patent ductus arteriosus, and the obstructive defects. And in babies with these heart conditions, they would have a high heart rate, high metabolic rate, which would equal poor weight gain for the baby, difficulty breathing, frequent respiratory infections, and fatigue. The atrial septal defect, also known as ASD, is an abnormal opening between the atria. This is a left to right shunt. The blood goes through a small hole between the septum, and it can be heard with a murmur. You can hear an audible murmur with an auscultation. And if it's severe enough, it will need closure later in childhood. The symptoms of a atrial septal defect in a baby would be shortness of breath, heart palpitations, like I said, an audible heart murmur. And most small ASDs close on their own. If they do have to close them in surgery, they can do it with a catheter procedure or an open heart surgery where they place a patch device on the hole to close it. A ventricular septal defect is an abnormal opening between the atria. Never mind. It's between the ventricle, not the one that says. It can also be heard with a murmur. It's a left or right shunt. It's the most common septal defect, and if it's severe, also need closure later in childhood. Most VSDs also close on their own, usually by the age of 6, but some take longer. In newborns, the symptoms can be shortness of breath, slow weight gain, and frequent respiratory infection. Some of my stuff, is this the right one? This is my stuff right here. My little thing. Anyway. Another is the patent ductus arteriosus. This is a failure of the fetal structure to close. The blood shunts from the aorta to the pulmonary artery. It's also diagnosed by an audible murmur upon auscultation. If it's large, it requires surgery. The patient is acyanotic due to increased pulmonary blood flow and obstruction to blood flow from the ventricle. It causes the heart to work harder, which can cause fluid to build up in the lungs. Slide.